So this is for the reflection video for wrist and hand. So question one was my evaluation comprehensive, why or why not? So I had a patient come in with it was a wrist and thumb. The patient jammed their finger in a practice. During the evaluation, I tried to do a better job with communicating and slowing down, especially with like the feedback that I had received from like my reflection. So this happened yesterday. So the patient had pain in thumb extension and flexion, which was like really painful secondary, or sorry, very limited secondary to pain. The patient, so when completing the range of motion, I found it kind of a little really straightforward. I think with the thumb and the hand, there isn't much else you can really do around there, besides, testing the abduction, the flexion, extension. And so I thought it was pretty straightforward. I did a grip strength test. It was kind of 4 out of 5, 5 out of 5 bilaterally, but that was kind of secondary to the pain. And so the patient kind of described the ball coming in contact with them like this. There was a possibility that I thought maybe there could have been a fracture. But overall, I think my evaluation, I did a pretty good job with my evaluation in like a complete context. Question 2 is, did my palpations, inspection, and an objective measure lead to a confident diagnosis? Going through my evaluation, I thought it could be a fracture or a thumb sprain, because from my own experience, I have damaged my own ligament, my UCL, and my thumb, so I know similarly what that feels like and how to kind of go about managing it. It kind of got tricky because the patient was like super sensitive to like point tender around the joint space. I felt like when I was doing the functional assessment and stuff, like it was just very limited because it was fresh. But I do think though that those key points led me to my diagnosis. So I think I did a pretty good job kind of isolating where exactly it was in the MCP joint and the UCL. I also want to mention that there was increased laxity with the joint space, because when I performed the valgus, there was pain and a little bit of laxity. There hadn't been any swelling yet, but bruising. There wasn't a lot of bruising yet, but there was a little bit of swelling around that joint capsule. So, but I did do the long bone compression test. I would say it was negative, because when applying the load, the pain wasn't through the bone. It was just tender on the outside. So I would classify that as a negative. And when I talked with my preceptor, they said that we don't want to completely rule that out, and it could be a possibility that it could be both a UCL and a fracture. So I don't want to completely throw that out yet. So, but I also did, what else? I did the Watsons. There was no pain significant to this scaphoid or any pain within the radial or ulnar deviation, so I knew it didn't radiate any further down. Discussed 2 things that I did well. I think I did a good job with communicating with my patient actively, as the patient was in distress, and I have And because I had my own personal experience with it, I think I did a good job trying to talk them through and try to get the exact like mechanism of injury and how it happened, and so that can lead me to a more confident diagnosis. I also think I did a good job with like not sticking to just the MCP joint. I think I did a good job with like following it down into the scaphoid and then just checking other ligaments within, because I also did the varus stress test as well. So the valgus and varus stress testing, I think I did a pretty good job with that. Areas of improvement, I think I would still like to improve to diagnosing the injuries and not like keeping myself stuck in a box. I've been really self-aware lately, trying to not do that, and so I want to continue to strive to do that. I think that'd be really important, always moving forward. And then lastly, another thing is the only thing that I did in the moment was I didn't test bilaterally besides the grip strength, and sort of kind of with the flexion. There wasn't any measuring, so I think I could obviously improve with remembering small details and always remembering to compare bilaterally, especially if I'm using like the varus or valgus where I want to test the laxity within the other joint space. But yeah, overall I think I did a pretty good job with diagnosing, and at the end we